Hi everyone, this is my brochure on Medicaid and Medicare. Um, it was really interesting doing this assignment because I knew for the most part the general information about each of these programs, but there was actually a lot that I discovered I didn't know, and so I'm hoping that you can gain some knowledge from this also. Um, Medicaid, what is it? So Medicaid is a federal and state assistance program serving low-income people of every age. Patients usually pay nothing for the covered medical expenses, although a small copayment may sometimes be required depending on what state you are in. Who all is eligible? This typically includes low-income families, qualified pregnant women and children, as well as individuals receiving supplemental security income. States may offer additional options for coverage, including individuals receiving home and community-based services and children in foster care who are not otherwise eligible. The benefits of Medicaid include the fact that it includes a child health insurance program known as CHIP. This offers comprehensive benefits to children. States may choose between a Medicaid expansion program or a separate CHIP, and sometimes even a combination of both types of programs. In states with separate CHIP, benchmark coverage is available and includes federal employee health benefit plans, state employee plans, and health maintenance organizations. These plans must include inpatient and outpatient hospital services, physical, surgical, and medical services, as well as laboratory and X-ray services. They also often include well baby and well child visits, dental visits, behavioral oral health benefits, as well as vaccination coverage. And so for the types of programs that Medicaid offers, again, it's just typically eligible to cover those um, through the health insurance coverage marketplace for those who qualify. Individuals who are citizens who do not qualify for Medicaid may sometimes still qualify at least their children for CHIP, or there may be other minimum essential coverage with incomes between the 133% and 200% federal poverty level. Medicare, on the other hand, is a federal insurance program where medical bills are paid from trust funds involving those who've paid into them. It serves people over the age of 65 and may also serve younger people who may be disabled and even dialysis patients. Patients often pay part of the cost through deductibles regarding their hospital and other costs involved. It's often similar in every state and is governed by the Centers for Medicare and Medicaid Services. So regarding who is eligible for Medicare, this again is people who are age 65 and older. Again, it may also include younger people with disabilities and those with end-stage renal disease or permanent kidney failure requiring dialysis. The types of plans for Medicare, there are a few different types, and these different parts cover specific services. So there is Medicare Part A. This covers inpatient care in hospitals, skilled nursing facilities, hospice care, and some home health. And typically no premiums are due to it having been paid for with payroll taxes. There is also Medicare Part B, and this covers doctor services, outpatient care, physical and occupational therapies, and it typically pays when medically necessary. And then Medicare Part D is for prescription drug coverage and often requires a monthly premium. And the benefits to Medicare is that, for example, Part B offers preventative services, cancer screenings, and wellness visits. So at the age of 65, we often see this population who tends to be more vulnerable to certain diseases and illnesses. So these benefits and preventative services are just a great aspect to Medicare. And another is the services and screenings include individual lab tests, shots, and monitoring, as well as counseling. So for my third category on my brochure, I just included costs and help with costs. So here I mentioned some of the typical Medicare costs, and then just some, I also included some things that one might look into as far as getting help paying for the costs involved. So for Medicare Part A, typically this runs around $437 a month for the average individual who qualifies. For Part B, it's typically $135.50. Um, Part D, it just varies depending on the monthly income. And regarding getting help paying for costs, there is Medicare savings programs, and these are state Medicare programs that offer help to pay for premiums, deductibles, co-insurance co-payments, as well as prescription drugs. There's also PACE, which is Program of All-Inclusive Care for the Elderly. It is a Medicare-Medicaid program that helps people meet healthcare needs in the community. There's also a Save on Drugs Costs program, and this offers just assistance paying for prescription drugs under Part D. It does require meeting certain income and resource limits. There's also programs for people in U.S. territories, so although they might not be in the United States directly, it offers assistance for those. For example, in Puerto Rico, the U.S. Virgin Islands, Guam, um, American Samoa, and it just, again, is for people with limited income and resources. There's also Find Your Level of Extra Help, and this goes with Part D in Medicare. And this just offers extra help for those needing the prescription drug coverage again. And then there is Insure Kids Now, and this is the Children's Health Insurance Program, so also CHIP. And it offers free or low-income coverage to more than 7 million children up to the age of 19. And coverage is provided to eligible U.S. citizens as well as immigrants. So I hope you enjoyed listening to my presentation and learned a lot about the differences between Medicaid and Medicare. Thank you. Bye.